Question 1. Which clinical manifestation should alert the nurse that a patient with sepsis is deteriorating? A. Increased bowel sounds. B. Capillary refill less than 2 seconds. C. Decreased urine output over 3 hours. D. Slightly elevated blood pressure. Answer. C. Decreased urine output over 3 hours. Question 2. A nurse notes mottled extremities in a septic patient. What should the nurse do first? A. Warm the room temperature. B. Check oxygen saturation. C. Notify the healthcare provider immediately. D. Apply compression stockings. Answer. C. Notify the healthcare provider immediately. Question 3. Which lab result requires immediate intervention in a patient with sepsis? A. WBC count of 11,000/mm superscript 3. B. Platelet count of 75,000/mm superscript 3. C. Hemoglobin of 13G/dl. D. Blood glucose of 120 milligrams per deciliter. Answer. B. Platelet count of 75,000/mm superscript 3. Question 4. A patient with sepsis is hypotensive despite fluid resuscitation. What is the next best step? A. Increase oral fluid intake. B. Start vasopressor therapy. C. Administer antihypertensives. D. Stop fluid resuscitation. Answer. B. Start vasopressor therapy. Question 5. Which patient is at highest risk for sepsis? A. A 20-year-old with a sprained ankle. B. A 55-year-old with a history of COPD and recent UTI. C. A healthy 30-year-old postpartum woman. D. A 65-year-old with controlled diabetes. Answer. B. A 55-year-old with a history of COPD and recent UTI. Question 6. What is the most important nursing action before starting for antibiotics for sepsis? A. Start for fluids. B. Document vital signs. C. Obtain blood cultures. D. Assess pain level. Answer. C. Obtain blood cultures. Question 7. A nurse finds a septic patient drowsy with a respiratory rate of 8 breaths/min. What should be done first? A. Stimulate the patient to keep them awake. B. Notify the family of condition change. C. Call rapid response team. D. Administer naloxone. Answer. C. Call rapid response team. Question 8. Which sign indicates that a septic patient may be developing acute respiratory distress syndrome, ERDS? A. Increased urine output. B. Decreased breath sounds bilaterally. C. Sudden onset of hypoxemia. D. Bradycardia. Answer. C. Sudden onset of hypoxemia. Question 9. A nurse is caring for a septic patient with MAP of 58 millimeters of mercury. What is the priority action? A. Document the finding. B. Encourage fluid intake. C. Continue current management. D. Notify the healthcare provider immediately. Answer. D. Notify the healthcare provider immediately. Question 10. What can the nurse delegate to a UAP when caring for a septic patient? A. Assess capillary refill. B. Administer for fluids. C. Assist with oral hygiene. D. Interpret lab results. Answer. C. Assist with oral hygiene. Question 11. Which intervention takes highest priority for a patient with suspected sepsis in the ED? A. Start telemetry monitoring. B. Administer a laxative. C. Obtain for access and begin fluid resuscitation. D. Place the patient in Trendelenburg position. Answer. C. Obtain for access and begin fluid resuscitation. Question 12. A nurse evaluates a patient's response to antibiotics. Which finding suggests improvement? A. increased respiratory rate. B. Persistent fever. C. WBC count returning to baseline. D. Decreasing urine output. Answer: C. WBC count returning to baseline. Question 13. A septic patient has cold, clammy skin, and weak pulses. Which stage of shock is suspected? A. Compensatory. B. Initial. C. Progressive. D. Recovery. Answer: C. Progressive. Question 14. What is the best way for a nurse to evaluate tissue perfusion in a patient with septic shock? A. Assess pupillary reaction. B. Monitor skin turgor. C. Evaluate urine output and LOC. D. Observe for nausea and vomiting. Answer: C. Evaluate urine output and LOC. Question 15. A septic patient is receiving norepinephrine. What should the nurse monitor most closely? A. Temperature. B. Peripheral pulses. C. Blood pressure and extremity perfusion. D. Respiratory pattern. Answer: C. Blood pressure and extremity perfusion. Question 16. The LPN is assigned to a patient with sepsis on 4 antibiotics. Which task is inappropriate to delegate? A. Monitor foresight for redness. B. Record intake and output. C. Teach signs of sepsis recurrence. D. Report elevated temperature. Answer: C. Teach signs of sepsis recurrence. Question 17. Which vital sign change should the nurse address first in a septic patient? A. HR 110 BPM. B. RR 24 per minute. C. Temp 101.3 degrees Fahrenheit. D. BP 80 50ths mmHg. Answer: D. BP 80 50ths mmHg. Question 18. What is the best indicator that fluid resuscitation is effective in a septic patient? A. Decreased temperature. B. Improved urine output. C. Decreased heart rate. D. Increased respiratory rate. Answer: B. Improved urine output. Question 19. Which is the most urgent concern in a patient with sepsis? A. SpO2 of 96%. B. Capillary refill time of 5 seconds. C. Oral temperature of 100.8 degrees Fahrenheit. D. Pulse of 92 BPM. Answer: B. Capillary refill time of 5 seconds. Question 20. What nursing intervention should be included in a care plan for a patient with sepsis risk? A. Avoid all invasive procedures. B. Monitor for early signs of infection. C. Limit fluid intake. D. Administer antipyretics for every fever. Answer: B. Monitor for early signs of infection. Question 21. A nurse suspects early sepsis in a post-op patient. Which action is most appropriate? A. Monitor hourly intake and output. B. Apply a warm blanket. C. Notify the provider and prepare to obtain cultures. D. Elevate the head of bed to 90 degrees. Answer: C. Notify the provider and prepare to obtain cultures. Question 22. Which task can the RN delegate to a UAP caring for a septic patient? A. Assess for signs of organ dysfunction. B. Administer oral antibiotics. C. Assist with repositioning the patient every 2 hours. D. Evaluate response to 4 fluids. Answer: C. Assist with repositioning the patient every 2 hours. Question 23. Which clinical sign indicates that a septic patient is transitioning to septic shock? A. Bounding pulses. B. Hypertension. C. Cold, clammy skin. D. Slight fever. Answer: C. Cold, clammy skin. Question 24. The nurse reviews a septic patient's lactate level of 5.5 millimoles per liter. What is the best interpretation? A. Mild dehydration. B. Metabolic alkalosis. C. Poor tissue perfusion. D. Normal stress response. Answer: C. Poor tissue perfusion. Question 25. Which finding in a septic patient requires immediate intervention? A. Heart rate of 105 bpm. B. Urine output of 15 milliliters per hour. C. Temp of 100.4 degrees Fahrenheit. D. BP of 118/78 mmHg. Answer: B. Urine output of 15 milliliters per hour. Question 26. The nurse is caring for multiple patients. Who should be assessed first? A. A sepsis patient with blood sugar of 140 milligrams per deciliter. B. A post-op patient reporting nausea. C. A patient with suspected sepsis and new confusion. D. A febrile patient requesting water. Answer: C. A patient with suspected sepsis and new confusion. Question 27. Which is the most important reason to begin antibiotics quickly in sepsis? A. Prevent drug resistance. B. Relieve patient discomfort. C. Improve immune system strength. D. Decrease risk of organ failure and death. Answer: D. Decrease risk of organ failure and death. Question 28. A nurse notes a map of 58 millimeters of mercury in a septic patient. What should the nurse do? A. Document and continue monitoring. B. Recheck the blood pressure in 2 hours. C. Notify the provider for urgent intervention. D. Elevate the legs and apply ice packs. Answer: C. Notify the provider for urgent intervention. Question 29. What lab value supports a diagnosis of sepsis? A. Hematocrit of 45%. B. Creatinine of 2.3 milligrams per deciliter. C. Hemoglobin of 14g/dl. D. Sodium of 138 milliequivalent/L. Answer: B. Creatinine of 2.3 milligrams per deciliter. Question 30. A nurse receives lab results on 4 patients. Which patient should be seen first? A. WBC 11,000/mm superscript 3. B. Lactate 4.2 millimoles per liter. C. Hematocrit 42%. D. Glucose 122 milligrams per deciliter. Answer: B. Lactate 4.2 millimoles per liter. Question 31. What is the goal of fluid resuscitation in septic shock? A. Lower blood glucose. B. Increase cardiac output and perfusion. C. Prevent fever. D. Improve bowel motility. Answer: B. Increase cardiac output and perfusion. Question 32. A nurse is teaching about sepsis prevention. Which point is essential? A. Always wear a mask in public. B. Get vaccinated and report infections early. C. Use antibiotics for all fevers. D. Drink only bottled water. Answer: B. Get vaccinated and report infections early. Question 33. A patient has a new order for norepinephrine. What must the nurse ensure first? A. The patient has an indwelling urinary catheter. B. The 4 is a peripheral line. C. A central line is in place. D. The patient is fasting. Answer: C. A central line is in place. Question 34. A nurse sees that a patient on vasopressors has a pale, pulseless foot. What is the priority? A. Elevate the limb. B. Apply warm compress. C. Notify the provider immediately. D. Document and reassess later. Answer: C. Notify the provider immediately. Question 35. Which infection is most likely to result in sepsis if untreated? A. Viral rhinitis. B. Fungal nail infection. C. Urinary tract infection. D. Mild sinus infection. Answer: C. Urinary tract infection. Question 36. Which action helps reduce mortality in sepsis? A. Waiting for culture results before antibiotics. B. Administering antibiotics within 1 hour. C. Starting diuretics early. D. Delaying fluids until BP drops. Answer. B. Administering antibiotics within 1 hour. Question 37. A nurse evaluates the effectiveness of vasopressors. Which finding indicates success? A. Improved oxygen saturation. B. Increased heart rate. C. MAP greater than 65 millimeters of mercury. D. Decreased respiratory rate. Answer. C. MAP greater than 65 millimeters of mercury. Question 38. A septic patient is disoriented and restless. What should the nurse do first? A. Reorient the patient. B. Apply restraints. C. Assess oxygenation and perfusion. D. Call security. Answer. C. Assess oxygenation and perfusion. Question 39. Which assessment requires immediate provider notification in sepsis care? A. Temperature of 100.6 degrees Fahrenheit. B. Urine output of 45 milliliters per hour. C. Sudden drop in systolic BP by 30 millimeters of mercury. D. Heart rate of 92 BPM. Answer. C. Sudden drop in systolic BP by 30 millimeters of mercury. Question 40. Which nursing intervention is critical after giving the first dose of 4 antibiotics for sepsis? A. Discontinue the 4 catheter. B. Monitor the patient for allergic reactions. C. Delay fluid bolus until lab review. D. Administer antipyretics immediately. Answer. B. Monitor the patient for allergic reactions. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.